Hello everyone. I welcome you all to today's session. Myself Rajita, and here we are going to discuss regarding another interesting topic of medical surgical nursing. Now the topic which we are going to deal today is unconsciousness. Now before going to discuss in detail about unconsciousness, I want to give you a basic idea regarding this term of unconsciousness. So as the terminology is suggesting, unconsciousness means the loss of consciousness. So often we see in hospital setup, sometimes patient can present actually with this condition where basically we are going to see the person sometimes will not be able to respond towards the external stimuli and the environment. Even they will not be aware of their surroundings. So those conditions we often call as unconscious patient or unconsciousness. Now we are going to see in detail regarding unconsciousness, the definition of it, the probable causes which can leads to the development of condition of unconsciousness, the often or common sign and symptoms which often being seen among the clients, as well as the basic management, and ultimately we are going to read regarding the nurses roles and responsibilities towards managing the client with unconscious. So here, as I have suggested, that unconsciousness is an abnormal physiological state. So why it is abnormal? Because here there are some conditions which is affecting the normal physiological process. There is a reason here the person is not conscious regarding the external stimuli, or they are not able to respond towards it. There is a reason the unconsciousness is defined as an abnormal physiological state, which is definitely resulting from disturbance of sensory perception here. Now, the sensory perception will be in that extent that the person will not be able to respond to the external stimuli, as well as sometimes they will not be able to get aware about their external environment. So definitely with a condition like unconsciousness, a person will not be aware about their surrounding. This is the first main point. The second one is they will not be able to respond towards the external environment or certain external stimuli, as there is disturbance of the sensory perception. Even the client with unconsciousness often will show the presence of lack of awareness regarding self and external environment. So that is how we are going to define the unconsciousness as a abnormal physiological state, which is often caused because of the disturbance into the sensory perception of an individual which is ultimately interrupting the response towards the external stimuli, as well as this condition is leading to a formation of complete lack of awareness of the client regarding self and the external environment here. So this condition of unconsciousness actually have a duration, or actually can have a duration very less amount of time. Even the condition of unconsciousness can last for a long duration. Sometimes you're going to see the unconsciousness can stay for a person even for a week or some few days, but most of the cases or majority of the client also will show the presence of unconsciousness for a long duration. It can goes to 1 month, even sometimes more than a month. So now we are going to read about level of unconsciousness. So here we are going to basically classify the unconsciousness level into 3 categories. The first one is excitatory unconsciousness. The second one is known as somnolent unconsciousness, and the third one is known as stuporous unconsciousness. So now we are going to deal about the excitatory unconsciousness. So the excitatory unconsciousness, in this kind of condition, if the person is affected with, we are going to see the individual will not be able to respond coherently or spontaneously. But here in excitatory unconsciousness, the client will be easily disturbed with sensory stimuli, with the external stimuli or sensory stimuli. So I hope you got the idea that in excitatory unconsciousness, although the patient will not be able to respond coherently or spontaneously, but we are going to see the client will be aware and will be able to respond minimally if an external stimulus is administered. Now, the example of excitatory unconsciousness is a person who is recovering from anesthesia. So basically, we are going to see here if a client has administered with some anesthesia, maybe a client who is undergone a surgery. Once they are finished with the surgery and they have shifted into the post anesthesia care unit, we are going to see while recovering from the anesthesia for some duration of the initial period, we are going to see the client will be in a phase which we can actually term it as excitatory unconsciousness. So the second level of consciousness is termed as somnolent. So here in this type of unconsciousness, we are going to see the individual will be having a very severe drowsiness or extreme drowsiness, and they will be having a very high feeling or severe feeling of sleepiness. So here we are going to see that the client will respond only if directly spoken to or if provided a physical touch. Then only maybe the person can actually respond. So here in this type of unconsciousness, the person will not be able to respond, spontaneously. We have to provide some external stimuli in order to get the response from them. Next, we are going to read about the stuporous unconsciousness. So in stuporous unconsciousness, we are going to see the patient will be responding here only to a painful stimuli. So in this stuporous unconsciousness, if we are pinching or pricking with some sharp object for the client's skin or body surface, then only the client will be providing some response towards the painful stimuli. Now, in case of deep stuporous unconsciousness, we are going to see the client here only is going to respond if there is presence or there is administration of painful stimuli into the suborbital and substernal areas. So here in deep stupor or deep stuporous unconsciousness, we are going to see the client will or the client may respond only if there is administration of painful stimuli to the supraorbital region and substernal region. Until and unless painful stimuli is administered into this particular two location, in case of deep unconsciousness, the client won't be able to provide a response towards it. Otherwise, in stuporous or in partial stuporous unconsciousness, we are going to see the client will be responding towards the painful external stimuli, that is basically administration of a pricking or a pinching administration to the body surface of the client. So now here we are going to read about the etiological factors which are often associated with the development of condition of unconsciousness. So the first and most common factor which is associated with the development of unconsciousness is the intracranial injury, or we can say the head injury. So head injury often will be associated with traumatic accidents, or maybe sometimes the head injury also can be associated with certain iatrogenic cause. Now, if this is occurring, if the head injury is present, often we are going to see the client will be showing a feature associated with the condition of unconsciousness. The next common etiological factor which is almost always associated with the development of unconsciousness is the structural lesion inside the brain. So structural lesion inside brain often will be suggesting or indicating to those kinds of condition like brain tumor or maybe cerebral hemorrhage. Now this both will ultimately can lead to the development of unconsciousness for our client. Cerebrovascular accident is a very common type of factor which is often associated with the development of unconsciousness. Here in cerebrovascular accident, we often see the presence of hemorrhage or embolic stroke related to the development of unconsciousness. The next factor is epilepsy or infantile convulsion. Now, epilepsy or infantile convulsion is basically indicating that condition where there is malproduction of the neurological impulses or electrical impulses will be there inside the brain. So here, if a client is having a history of epilepsy as well as infantile convulsion, we may able to see the person can go for unconsciousness or unconscious state. Transient ischemic stroke also will be considered is a very common risk factor for the development of state of unconsciousness. Poisoning and drug overdosage. Certain drugs, even the side effect of anesthesia sometimes can lead to the development of unconsciousness for a client. So here I hope we have learned about the most common causes that can be related to the development of unconsciousness. Now you have to remember all these causes are intracranial causes or directly affecting the brain and its function. That is the reason here, as our sensory perception is diminished here, the client is showing the feature associated with unconsciousness. Next, we are gonna read about certain extracranial factors or disease conditions which ultimately can affect the function of the brain. Now, it can involve different parts of the brain. Depending on that, the client will lose their sensory functions majority. So, in case of unconsciousness, often we are gonna see different parts of the brain will be involved into the pathophysiology of unconsciousness. So now let us discuss regarding the extracranial factors associated with the development of unconsciousness. So the first condition is traumatic accidents. Now the traumatic accidents is a very common factor which will be often associated with the development of unconsciousness. The next one is severe hemorrhage or bleeding. So sometimes the client can actually meet with a traumatic accidents which may cause certain hemorrhage or external hemorrhage. Even if a person is having certain internal hemorrhage, that also can lead to the development of unconsciousness if it is severe enough or if the individual's body is not able to manage the condition of hemorrhage. Next, we're going to learn about the alcohol poisoning. Even drug overdosage can affect the circulation to the brain, which will be ultimately causing the development of unconsciousness for a client. Metabolic disorders often will be associated with the development of unconsciousness. The disorders like infections, hypoglycemia, nutritional deficiency, even acidosis can ultimately lead to the development of unconsciousness and its associated feature for individual client. Shock and neurological syncope often will be associated with the development of unconsciousness. Now, extreme temperature of the body can also lead to the development of unconsciousness. For example, if a person is having hypothermia or if a person is having hyperthermia, that is beyond the level of the normal level of temperature of the body, we are going to see the client can show the feature associated with unconsciousness. The next condition is hypotension, or a decreased or a severely decreased blood pressure can also lead to the development of unconsciousness. Next, group of liver diseases also can lead to the development of unconsciousness due to its pathophysiological process. Next, we're going to see the fluid electrolyte imbalance if it is present for an individual and if it is beyond the normal physiological level, we can see the presence of the manifestations related to unconsciousness. The next condition, which is very oftenly associated with the development of clinical manifestations and unconsciousness, is diabetes, ketoacidosis. Dehydration also can lead to the development of unconsciousness. Next, we are going to see the presence of cardiovascular disease, which is interrupting the blood circulation into the cerebrovascular circulation. We're going to see these conditions even can lead to the development of unconsciousness. That is the reason a person with a severe heart blockage or a sudden heart failure may seem unconscious at initial period. Hyperventilation. Hyperventilation almost always will be associated with the development of unconsciousness. The next conditions, which are not very common but can be associated with the development of unconsciousness, are related to the psychogenic causes. Now we are going to learn which are the psychogenic causes can develop the condition of unconsciousness. So basically, hysteria, depression, and catatonia can actually lead to the development of unconsciousness. Catatonia often will be, is a very rare causes considered to be. But severe depression also is rare and hysteria also rare, but this can be associated with the development of, unconsciousness often for a client. So as we have learned regarding the most common and probable causes of the development of unconsciousness, now we should learn the basic idea regarding how these causes are ultimately developing the symptoms associated with unconsciousness, compressing the brain stems or certain parts of the brain. Otherwise, the conditions often will be causing disruption of the circulation towards the cerebrovascular circulation. There's a reason we are going to see as there is lack of blood supply. That is the reason why the person is going for a hypoxic state, or the brain is in a hypoxic state, where we are going to see the development of ischemia can occur further, which will be ultimately leading to the development of dysfunction of the parts of brain. Now, as we know, the central nervous system is the main part which is often involved in our sensory perception and also the response to the external and internal stimuli. We are going to see as the brain's part are going under ischemia, they definitely will be losing their functional ability. That is the reason our client is showing the clinical manifestations as they're not able to respond to the external stimuli, or the client is not aware about the self and external stimuli. So these conditions or ischemia can ultimately lead to the formation of coma as well. So client can have the sign and symptoms in a very initial period only if the circulation or the blood circulation is disrupted completely. Now, if the disruption of the blood circulation is minimal, we are going to see the client can show the feature, and if the treatment and management is initiated at a very early stage where the ischemia has not been occurred into the brain and central nervous system, so here the client actually can prevent it with the development of unconsciousness and its related manifestations. So now we should learn about the clinical manifestations which are very commonly seen among the person who are suffering from or who are having the state or who have reached the state of unconsciousness. So first and foremost important sign or symptoms which is almost always be very identifiable for a client at an initial stage is sudden unresponsiveness towards the external stimuli. So we are going to see here the client will be developing a condition where in any scenario suddenly the client will not be able to respond, or there will be inability to respond towards the external stimuli. So that is the first indication the client or the caregiver or the surrounding people can identify that client is having in an unconscious state. The second very common feature is a slurred speech. So here often a client with unconsciousness will have the slurred speech at initial period. We're going to see the client will be having difficulty into the speech, even their the sentences will not be very understandable. So it is an indication that the client may have symptoms related to the unconsciousness. Rapid heartbeat. So often we're going to see at initial phase, the client who are going to be into the unconscious state will be having a very high or very rapid heartbeat. The next one is confusion and disorientation. Often, a client who is in an unconscious state or who is in an initial state of unconsciousness, we are going to see the client will not be oriented with the time, either with the location or place where he or she might be placed. And third, the persons who are known to them. So they will be having disorientation towards the time, place, and person. They will not be able to understand and able to respond that where are they actually, which is the place they are actually, or which is the time of the day actually is there present. So that is how we're going to see disorientation and confusion related to basically the time, place, and person often will be indicating that the client is having an unconscious state. Dizziness and lightheadedness often will be complained by a person initial stage of the development of unconsciousness. So I hope till here you completely understood and we have read about the most common clinical manifestations associated with unconsciousness. Now, definitely the client may have certain other symptoms associated with these conditions as well. Some client will be having difficulties of recognizing their own self. Even there can be presence of symptoms like uncontrolled voiding of urine and stool. Often the client can actually present with excessive sweat, which we know call it as diaphoresis. So these are all the very common features which can be seen at the initial phase of a person who is going for unconsciousness state or unconscious state. Suppose if a client is having underlying disorders that is basically related to the cardiovascular system, we're going to see the client may present with some symptoms associated with cardiovascular disease. Even suppose there is presence of head injury, so we are going to see a huge hemorrhagic changes or huge hemorrhage or bleeding from the injured part. These symptoms are also indicating, or these signs are also indicating that client is having a high risk for the development of clinical manifestation associated with unconsciousness. So as we have learned regarding the clinical manifestations and the basic of unconsciousness, you need to make it clear that whether you are a medical professional or not, or whether you are a lay person, you need to make it clear that the sign and symptoms are very common and you are able to identify the high risk for the client who will be going under unconscious state. So the first and foremost role of every person is to take that client into a medical setup where emergency management can be initiated. Because remember, unconsciousness often will be associated with certain underlying severely progressed disorder often. So that is the reason treatment towards those disorders or diseases is very effective management to manage the client and prevent the severe stage of the development of unconsciousness. Next, we're going to see here the most commonly used diagnostic studies in order to find out the condition of unconsciousness and its related causes. So primarily when a client in an unconscious state is presented by their caregiver to a clinical setup, it is a medical professional's role to collect the detailed history from the patient caregiver, or maybe from them who are accompanying the client or unconscious client into the clinical setup. So as a medical professional, first and foremost thing, you will be focusing on the present scenario. The caregiver or the accompanied people should be asked about the whole scenario, where exactly the incident happened and how it happened. So sometimes often the data will be suggesting that the client had or have had a stressful environment, or maybe excessive psychogenic stress also sometimes will be the causes related to the development of unconsciousness. So as a nurse and as a medical professionals, we should collect the history in detail. Even the caregiver would be definitely asked about the present and past medical history of the client. Next, the important data should be collected regarding the present or past surgical history of the client. Even the lifestyle of the client also should be noted down. So their habits, their exercise pattern, the food intake, their intake and output, everything should be noted here. Habit of smoking and alcohol consumption also should be noted. So even the caregiver would be asked about to share the information related to any known family history. So basically, this data collection will be helping our nurse to identify the risk factor or the probable causes associated with the development of unconsciousness. That is the reason the data or the collected data will be helping a medical professional to decide the plan of action and the most useful diagnostic measure in order to find out the exact causes which are lying behind the development of unconsciousness for the particular client. So, after history collection, it is a very important role of a nurse or a medical professionals to perform the physical examination. Basically, the physical examination will be done in a head-to-toe assessment as well as systematic assessment, where the probable sign and symptoms will be found out, and it has to be noted by a nurse in a chart that would be helping a medical professional or basically a physician to understand the probable disease condition which is present and which may be associated with the development of unconsciousness. So often while doing a physical examination, our client would be present with certain symptoms like, hypoglycemia, or we can find out that the person is having less pulse or certain decreased blood pressure. Now this all data or findings of the physical examination is basically helping a medical professional to decide the plan of action and diagnostic measures in order to manage the condition of unconsciousness. So next we're going to see the usage of certain definitive diagnostic management associated with the Glasgow Coma Scale assessment. These are often the computed tomography. So computed tomography will be used often in order to find out the exact probable conditions which is often affecting the brain and its tissues. So computed tomography will be done to find out any presence of cerebrovascular accident or any hemorrhagic stroke or any embolytic stroke or any abnormality related to the brain and its structure. We're going to see usage of magnetic resonance imaging. Even electroencephalography often will be helping to identify the physician the pathological process which is going under and affecting the normal functional ability of the brain and leading to the development of unconsciousness. So data collected or the test report will be always helping a medical professional to manage the client in a very prompt way. The next one is lumbar puncture. Often lumbar puncture would be done if a client is suggesting that she or he is having certain infectious disease condition that may have caused the unconsciousness. Ventriculography almost always will be done. Even angiography can be performed if there is the symptoms associated with the embolytic stroke or hemorrhagic stroke is present. Basically, this angiography will be helping to identify the exact location of the emboli and also will be helping to removal of it, and probably this management would be helping to manage the condition of unconsciousness for our client. Next, we are going to see certain assessment associated with the blood test also will be done in order to find out the drug level if the unconsciousness has been caused because of drug overdosage or drug toxicity. We're also going to see the liver function test will be done. Respiratory function test also will be done for a client in order to understand whether the person is having any respiratory difficulties or respiratory alkalosis or acidosis, which is ultimately related to the development of the state of hypoxia. Liver function test often will be done to find out whether there is any presence of liver disorders which can affect the mental status of the client. So monitoring of the blood gas or arterial blood gas analysis should be done for a client who is in an unconscious state. This definitely helps to physician to understand the pH level of the particular individual as well as the oxygen and carbon dioxide or partial pressure of the oxygen and carbon dioxide within the body. That definitely helps a physician to manage the client if the unconsciousness is related to the acidosis and alkalosis. Even assessment will be done for the serum glucose level, the calcium, sodium, and electrolyte balance should be checked in this diagnostic assessment and studies. So as we have learned, this all laboratory diagnosis as well as certain diagnostic procedures will be performed for the client in order to make sure or in order to conclude the underlying disease condition which is related to the development of unconsciousness. So as we have studied regarding the diagnostic studies in detail, now we should learn about the management or the basic concept of the management of the patient with unconsciousness. So before going to management, it has to be very clear for you guys that this condition is considered an emergent condition. So proper management should be initiated at earliest. Now, if the unconsciousness is related to a visible injury or a known disease condition, prompt management of that particular disease or scenario would definitely help a client to prevent or to go for any complication development. Now, for example, suppose a person have presented in a hospital setup in unconscious state with a visible hemorrhage or severe visible injury or traumatic injury. Now, definitely, the medical professionals, the first responsibility of them is to manage the injured part, to manage the bleeding as well as to prompt the or to initiate the prompt management in order to manage the client here. Even in these cases, advanced life support also will be provided to the client. So as I have mentioned, if the scenario is known to the physician that is the reason why the unconsciousness is have developed, definitely the prompt management should be initiated even before going for a prolonged diagnostic test and procedure. If the client have presented with unconscious state but not showing a visible disease condition or visible condition which is related to the development of unconsciousness, definitely along with the initial management or emergency management, our client client should be sent for a detailed diagnostic procedure or diagnostic studies in order to find out the probable causes behind it. As I have mentioned that it is an emergent condition, so as soon as a person is presented in a hospital set up in unconscious state, the first and foremost important role of a medical professional, basically the nurse, is to assess the ABC approach, or we can say the assessment would be done by following the ABC approach. ABC approach basically stands for the airway, breathing, and the circulation. So I hope we have learned about the ABC approach in CPR or cardiopulmonary resuscitation in detail. So that is the assessment here also should be done for an unconscious client. Now, in airway patency should be checked here, the breathing pattern should be checked as well as the circulation should be checked for the client. Now, if the client is having any altered scenario and any need of the accepting a life support, definitely a advanced life support should be provided. Even cardiopulmonary resuscitation would be administered for the client. Now, detail of the advanced life support and cardiopulmonary resuscitation already have been dealt in the cardiovascular system and related disorders chapter. So we're going to see here the basic management would be done preferably in an initial period with a ABC approach and with advanced and cardiac life support. Next, definitely oxygen administration should be done if the client is having a lower saturation of oxygen in their body. Oxygen administration makes sure that the client is not going for a further hypoxic state. So once the oxygen administration had been done, definitely after that, maintenance of our intravenous line should be assured or should be ensured by a nurse. Now, intravenous line should be created in order to provide electrolyte and fluid if it is needed. Even to administer medications, the intravenous line will be introduced for the client with unconsciousness. Often emergency medications will be provided. Emergency medications basically includes the usage of atropine, adrenaline as required by the clients. Next, we are going to see after doing the initial procedure like the advanced life support or maybe a cardiopulmonary resuscitation, the client may need a ventilator support. So definitely with the unconscious state, a client may be provided with a ventilator support. So if the client is showing any feature associated with seizure control here plays a very important role to manage the metabolic condition and the physiological state of the client. So controlling of the seizure would be definitely done with administration of anti-seizure medications as prescribed. Now here also the immediate management, as we have studied that the basic life support would be provided or advanced life support would be provided. These are the initial management would be done for the client if they are present in an unconscious state. Now, once the initial and immediate management is done for the client in order to save the life, next, definitely we are gonna identify the exact causes and disease conditions of the client. Once the client is physiologically and hemodynamically stable, we are gonna next try to initiate the management in order to manage the underlying disorders. So identifying the disorders and managing the disorders will be definitely depends on the patient condition. So as I have mentioned, the various causes which are associated with the development of unconsciousness, definitely if the client is present with a condition, depending on that, the client will be managed. If the client is having a hypoglycemia, administration of glucose play a very important role. If the client is having a malnourished condition, administration of or needed nutritional support is very important here. Underlying disease condition like any cardiovascular or neurological disease need its own type of management, which will be basically prescribed and planned by a physician with a nurse. Now here, as we have mentioned, that the immediate management and the further management would be definitely helping the client to maintain their physiological state. But as we have learned as that the unconsciousness can be last up to for a month or maybe for more than a month. Now, continuous monitoring and continuous management should be ensured by a nurse for the patient who is in unconscious state. Now, you have to remember or you have to note it down that it is very important to know that the client in unconscious state will definitely not be aware about themselves and their surrounding. So here, the client will not be able to communicate often with the nurse and the medical professionals about their need. So as a nurse, it is our role to assess the need of the client who all are in an unconscious state. Assessment of the need of the client should be done at a regular interval in order to manage the client with their complication and symptoms at a very initial stage. So here, the continuous monitoring basically will be including The assessment of Glasgow Coma Scale. So Glasgow Coma Scale will be basically helping a nurse to understand the neurological status of the client, which will be often communicated to physician. Now, depending on the neurological state and their responses, a physician would be suggested or will be prescribed medications and further therapies. Now, improvement in Glasgow coma scale often is indicating that the patient is definitely responsive towards the suggested and prescribed management. So then this treatment procedure, what has been prescribed, will be continued. If the person is not showing any positive response towards the treatment, maybe a physician or a group of medical professionals will be deciding to change for the further management of the client. So that is how the continuous monitoring of the Glasgow Coma Scale helps a nurse and medical professional to find out the improvement and the status of the client with unconsciousness. The next monitoring should be definitely done for vital signs. So a continuous monitoring of vital signs is a very important role of a nurse and other medical professionals, because the vital signs or the alteration in the vital signs will be suggesting a early stage of any altered physiological state for a client with unconsciousness. This definitely helps the medical professionals to identify the exact pathological state as well as to manage it in the initial stage. That's how prevention of the complication for unconsciousness or associated with unconsciousness will be done in a clinical setup. Next, we are going to see a hemodynamic monitoring often will be done continuously for the client with unconsciousness. Diagnostic tests like a complete blood count, or maybe the liver function test, the respiratory test, even the tests for different infections would be definitely done if the client is present in a chronically state or chronically presence of unconsciousness. Basically, a diagnostic state at regular interval helps a medical professional and nurse to identify any alteration of the physiological state at a very early or initial phase, which would be managed early and which would be managed better, and also it will be helping to prevent any complication development. So now we're going to learn about the basic nursing management or nursing role to manage the client with unconsciousness. So as I have mentioned, primarily the nurses would be performing the history collection, preferably from the caregiver or the person who are accompanying the unconscious patient into an emergency department. The next role of nurse is assist the physician into performing the physical examination, where the nurses would be noting down all the identifiable signs and symptoms that is probably patient for the client, and definitely which will be helping the medical professionals to identify the probable causes related to the unconsciousness. The next part of or the next management or role of a nurse is definitely initiating a very quick and prompt management if the client is in a severe state. Here, as per the requirement of the client, definitely advanced or basic life support will be initiated by an emergency nurse. Even airway, breathing and circulation will be assessed and managed by the nurse here. Oxygen administration and ventilator support should be provided to the client. Management of the client into the ventilation should be done in a proper way. A continuous monitoring of the vital signs, hemodynamic stability should be done. The next part is, once the diagnostic tests has been prescribed, it is a nurse's role to perform all the probable diagnostic tests that has been prescribed by a physician to find out the probable underlying disease condition related to the unconsciousness development. Here, nurses play a very important role to identify all significant laboratory and diagnostic study results, and they will be having the role to communicate with the physician in order to initiate the prompt management to manage the client. Now, the physician, once they are prescribing certain medications or treatment therapy, it is a nurse's role to continue the treatment therapy for the unconscious patient. Now, as the patient here will be unconscious, will not be able to communicate their need, it is a nurse's role to advocate from the patient side about their need. So here nurses plays a very important role related to the continuation of treatment and administration of prescribed drug. Infection prevention here plays a very important role. So often a nurse would be performing all the hygienic practices and they will be maintaining all the aseptic precautions for the client of with unconsciousness in order to prevent the chances of the infection development. So oral care definitely would be preferably provided by a nurse to manage and to maintain the oral hygiene. Proper exercise of the client should be ensured by a nurse in the case if the client is with unconsciousness. Exercise or a passive exercise definitely would be helping to maintain the circulation within the client's body. Prevention of the pressure ulcer here plays a very important role, because remember the pressure ulcer are very common among the patient or with unconsciousness, because definitely the patient won't be able to spontaneously move their body and change their position. So it is a nurse's role to ensure and to prevent the pressure ulcer formation for a patient with unconsciousness. So definitely in order to do that, a nurse would be definitely provide a very comfortable bed with the client or for the client. They will be even provided with a air mattress and all other comfortable devices as required. Nurses plays here a very important role to change the position of the client at a regular interval as suggested. So that's how the pressure ulcer prevention would be done by a nurse. The next role of the nurse is to save the client from any type of injury. Now, it can be a physical injury or it can be a iatrogenic injury. So as the client here is in an unconscious state and not able to communicate, it is a nurse's role to prevent all the probable type of injury. So the next role of a nurse is to ensure adequate nutritional status. Often a client with unconsciousness may go for malnutrition. So that is the reason why a nurse should assess the nutritional requirement, their body weight, their BMR, as well as their body mass index. Depending on that, associated with nutritionist, nurse here play a very important role to plan the diet chart and providing all the IV fluids and IV administration as well as the supplementation to the client with unconsciousness. Fluid electrolyte balance or the maintenance of the fluid electrolyte status in the body also is a very sole responsibility of a nurse. Administration of medication would be definitely done by a nurse. So definitely a proper medication chart here will be followed as prescribed by the physician. GCS scale scoring and vital signs monitoring at a regular interval, even this hemodynamic stability or hemodynamic status monitoring continuously should be done or should be ensured by a nurse in order to manage the client with unconsciousness. So as I have mentioned, this sole responsibility of a nurses, these are the primary responsibility of them in order to manage the client with unconsciousness. Now, it is also a very important role of a nurse to communicate the adequate information to the caregiver of the client, because you have to remember the client's caregiver here will be having so much psychological stress and anxiety. That is the reason a nurses here plays a very important role to communicate the necessary information and data to the caregiver of the patient. As well as the nurses have a very well responsibility here to communicate all the incident that is happening with the client in a hospital setup with the physician. so that the treatment procedure can go smoothly. So I hope till here you are completely understood the concept of the management of a client with unconsciousness. Now here, often the client will be present with certain physiological complication as well. So the nurse plays a very important role to prevent the complications as well. That is the reason we need to learn about the potential complication associated with this condition. So the potential complication almost always consists of the development of coma for the client. Brain damage is a very common complication associated with the unconsciousness. Choking and aspiration is a very common problem or complication for a client with unconsciousness. So that is the reason here nurses would be playing a very important role to prevent choking or aspiration for the client with unconsciousness. So also nurses plays here a very important role to manage the client if they are in ventilator. So ventilatory support should be provided adequately here in order to manage or prevent the complication development. So I hope now you're completely clear about the probable or potential complications related to unconsciousness. Now, the chances of infection development is also very commonly seen among the patient with unconsciousness. So, nurses plays a very important role to manage and maintain the hygiene surrounding and as well as for the patient. So as we have studied here about the detail about the management, now we will be just summarizing the important and initial management that should be promptly done for the client with unconsciousness. So first and foremost, once the unconscious patient is presented to a hospital setup, first and foremost important part of nurse is to check their oxygen saturation level and providing oxygen administration via a nasal cannula or maybe a mask. The next one is providing the life support, basic or advanced life support depending on the client's need. Now the next thing is creating an intravenous access line in order to introduce the emergency medications or maybe maintaining the fluid electrolyte balance for the client. The next step is stabilizing the cervical spine with proper positioning of the client. Then the next part is the maintenance of the blood glucose level for the client. So here, maintaining of the position of the client and maintenance of the fluid electrolyte and blood glucose level plays a very important role to manage the client with unconsciousness. The next part of the management includes control of seizure. So here basically the administration would be done for the anti-seizure medications. Even depending on the client's need, glucose would be administered, thiamine also would be administered, even certain anti-seizure medications can be administered for the client if they are showing any state of hypoglycemia, any kind of malnutrition, even kind of presence of seizure. So as initially the patient is managed and patient is maintaining a normal hemodynamic stable condition or status, next the nurses play a very important role, or all the medical professionals have the role to perform a brief examination and history collection again to find out the probable risk factors and probable indicators that are associated with the development of unconsciousness. Next we are going to do or we are going to see an extensive level of investigation procedure would be suggested for the client in order to find out the exact causes related to the development of unconsciousness. That is how, with initial management and emergency technique, the patient will be first stabilized in a hemodynamic state. Next, we are going to see the client will be managed with the underlying disease condition that is causing the development of unconsciousness. So I hope in this session you have completely got the idea related to the unconsciousness. So we have seen the definition, the probable etiological factors, the pathophysiology of basic of pathophysiology which is occurring in order to develop the signs and symptoms related to unconsciousness. As well as we have seen the level of unconsciousness that basically includes the presence of excitatory unconsciousness, somnolent unconsciousness, as well as stuporous unconsciousness. We have seen here the basic and most common signs and symptoms. So we have seen the client with unconsciousness definitely will not be able to respond to the external stimuli. Often the client will not be aware about the external surroundings as well as about their self. We have seen also certain clinical manifestations which commonly associated with the unconsciousness for our client. Next, we have learned about the most important or most commonly used diagnostic procedure and laboratory studies, which are often done for the client in order to find out the exact causative factor for the development of unconsciousness. Next, we have learned about the management. Here we have seen the emergency management, which will be generally provided with a ABC approach, that is airway, breathing and circulation maintenance approach. We have seen the client will be managed initially even with the administration of basic life support and advanced life support. Next, we have seen the IV channel access would be done in order to administer the emergency medications. As the patient is stabilized with this initial and prompt emergency management, next, definitely the client will be undergoing certain diagnostic procedures to find out the exact causes, and the preferable management would be planned by a physician and associated with a nurse in order to manage the client and prevent any complication development. We have also learned about the nurse's role to manage the client with unconsciousness. We have seen here the nurse plays a very important role to manage the airway, the nutritional status of the client. Also, they have a very important role to prevent the infection and pressure ulcer formation. They will be also having a responsibility to change the position properly, or they have a responsibility to provide a client with a proper and comfortable positioning. Nurses here plays a very important role as a communicator. They will be communicating the need of the client to the physician as well as all about the treatment procedure to the client's caregiver. That is how the nurse would be going to manage the condition of unconsciousness. So I hope you've enjoyed this session. Thank you so much for attending this one. We'll meet you guys in the next session.